Welcome to Stoughton Media Access Corporation's Community Forum Show. My name is Steve Kelley and I'm your host today. And today I have the pleasure of introducing you to a couple of people who are working in the REACH program, which is the Racial and Ethnic Approaches to Community Health.
You got it.
And Alice Rebelo is over here just watching the words roll off my mouth, praying that I get it right. Alice is the program director. So welcome to the show.
Thank you, Steve. It was great.
Right, and then we have Kendall Bennett, and she is the program coordinator. Mm-hmm. Is that right?
Yeah.
So we'll reach over and get your hand, okay? So welcome to the show, and thank you for coming to share this important work. So Alice, we could start with you. Tell the audience, what is REACH?
So REACH, as you said, is the Racial and Ethnic Approaches to Community Health, and we have a mission within REACH. So our mission is to prevent, identify, and manage chronic disease. And racial and ethnic approaches is because the highest incidence of diabetes is among the African American Black populations, thus the racial and ethnic approaches. So it's customizing the delivery of services and how to reach to this population in order to get them to, again, to prevent, identify, and manage the chronic disease. And Kendall will speak a little bit more later to the incidence of diabetes among the populations.
So there are three primary diseases that you're hoping to have an impact. What are they?
So one is hypertension, heart disease,
Okay.
diabetes, and asthma.
And asthma. So those three. And they relate to sort of smoking, overeating, and overdrinking?
It relates everything we do. If we don't follow a healthy lifestyle and we make poor choices, they all have an underlying factor. So it's all the common denominators.
Okay, so let me switch to Kendall. So Kendall, I think the Y has some involvement. Can you share a little bit of the background for REACH and how it came to pass, what the window of opportunity is for you guys?
Definitely. So in the past, the Y has started to wade into this territory outside the four walls of the gym and swim, as they call it. So not only is it a YMCA for its members, but it's also doing community outreach just to make the community a better place because it is a nonprofit and that is its goal altogether. So they started to get some grant funding for some policy systems and environmental changes through Y of the USA and through a couple foundations throughout the country. And they started working on the sidewalks in Stoughton and Easton and around the areas. And a couple other things where they really started to make a pretty cool impact. They worked with the Youth Commission on the CAP playground, things like that, the farmers market in Stoughton, and they've had a lot of success. So last fall, they went directly to the Centers for Disease Control and Prevention and applied for this REACH funding on their own and were awarded as an individual organization $1.2 million for 3 years to reduce chronic disease, specifically in Stoughton and Brockton. But the infrastructure and the linkages that we'll build will be, for all the surrounding communities.
You used the word linkages. Alice, let me ask you, how does that word play into what you're doing? What this idea of community linkages?
Right, so the new buzzword these days, and people hear this throughout, is the community to clinical linkages. And so what we hope to do is identify gaps in the community. Why are people not accessing health care? And how can we go about making sure they access health care, making sure that they communicate with a clinician, with a nurse, with a primary care physician, somebody. We hope to bridge that gap. We hope to provide resources and tools so that the community can very easily access health care.
And when they don't access health care, they end up in emergency room settings.
They end up
right?
in the emergency room settings. Health costs go up, and health costs going up affects everybody. It affects a higher copay, higher medication, higher insurance premiums, low productivity at work, insurance policy premiums go up. So it affects us all.
Okay. Kendall, you have a background in statistics, right? You have a biostat. We were talking offset that you have a biostatistic degree. Talk about the baseline. What is the baseline that you would establish, or how would you establish a baseline to even like scratch the surface of accountability?
So I think the reason that the CDC ever considers giving money, has to go back to the data. So this snapshot of our community was something that they found interesting. So one of the major data sources that we had was through the Greater Brockton Health Alliance. They do a community health needs assessment every few years. And some data from that community health needs assessment was a little alarming. So the state, using diabetes as an example, has a rate of 8%. 8% of adults have diabetes, and the Greater Brockton area has a rate of 9.4%, which is not in itself frightening, because we do have a small city around, and it includes a large area. But the problem was that in Massachusetts, the rates are going down a little bit, and that's great. But in our area, it's going up significantly. So they saw this as a great opportunity for us to completely squash that, make it stop, and match the rest of the state and start chipping away at our rates and helping the community to be healthier. Another really interesting data source that we got from the Robert Wood Johnson Foundation is that the amount of visits to the emergency room that are for non-emergencies, for things you could just go to a normal health clinic, minute clinic, doctor's office, is 44%. So when people complain about having a really long wait in the emergency room, it's because 1 in 2 people don't need to be there. And that's really something that we would love our clinic to community linkages to really help chip away at that number.
Good. So Alice, one of the sort of tasks at hand is to build this coalition of clinics and places that you can go, alternatives to the emergency room. So how have you gone about doing that? So
we formed a coalition of healthcare providers, of community representatives, of faith leaders, of barbers, anyone in the community that provides the service.
Wait. Barbers doesn't seem to fit in that.
It does fit,
Tell us
Steve.
how. Tell us why.
I'll tell you why. So you go to your barber for the last 20 years, and then you don't go for like a month or so, and he sees you back, and he says, Steve, where have you been? I haven't seen you. You say to him, really haven't been feeling well. I feel dizzy and sweaty all of the time, so I just haven't been. And he says to you, why don't you go have yourself a checkup? And you say, I don't have time for a checkup, I don't have time to have a checkup. But he says, well, look at that flyer right there. They have a health screen coming up right outside City Hall, and it's free, and it's on a Saturday. I want you to go.
What's a health screen? When you say a health screen,
so a health screening is provided by a healthcare provider with whom we've partnered, and I'll speak to a little bit later. So a health screening can provide you a cholesterol check, a blood pressure check, a glucose check. So if your sugar are high, they're going to recommend that you follow up with a physician. If you have high blood pressure, they're going to recommend that you follow up with a physician.
What does it cost to have the health screening?
It's absolutely free.
So anyone if you want to have a health screening and you can tune into one of these days through these sources, you're going to drive in, walk down, and just
get a screen
and get someone interested in you, interested in your health, with the hope of giving you better health.
Right. So through our coalition, through the relationships that we have that come around on a quarterly basis, we talk about creating venues. But behind the scenes, Kendall and I develop relationships at the community level, creating those outlets, creating those venues in which we can provide those health screenings. So speaking to employers, speaking to churches and synagogues and health centers, a place where people shop.
What about like the farmers markets?
A farmers market, a Vicenta's market just came to mind. Where people go and shop is people go to work. It's a perfect opportunity for people to access health care without having to worry about, I don't have insurance, I'm an illegal alien, I don't have enough money for a copay. It doesn't matter who you are.
You just want the community to be healthier.
Absolutely.
And it's all tax dollars, so if you're a person who's saying, well, who's eventually going to pay for it? Well, we're paying for it, you might as well access it.
Absolutely.
It's kind of in other words,
Absolutely.
It's not quite what you want to hear, that it's being paid for by the public time, but at the same time, if it's available, then perhaps it needs to be something that everyone can use to benefit their health, right?
All right, and this is where the community to clinical work comes in, and the linkages, is creating those links so that people can access health care where they live and where they work and where they shop.
So what happens if those linkages aren't there, Kendall?
So there are definitely places coming in where linkages do exist, but there are a lot of places where they don't. And I think from what we've been seeing from sort of our focus groups and our interviews with the community is that people just don't know where to access healthcare. Maybe they, don't have a car, or they don't know how to get the transportation to go to a doctor's office. So it's really important for us to make sure that they make that connection, they find a primary care provider that they trust and that they feel confident in, and then they'll feel comfortable going back to that same, it's called a patient-centered medical home. They'll go to their medical home where that doctor can refer them out to another doctor or a specialist or a certain test, and we want them to go to a place where they feel safe, because just going to the emergency room where some doctor is working the night shift and he really doesn't want to be there, and he's dealing with really stressful, scary cases. It's not a safe, warm, home feeling, and so we really do want people to get that feeling where they have trust in the person. They can call them and say, my diabetes is getting worse. I've been dizzy all the time, and we want people to call ahead and do the prevention so that they don't wind up, fainting and having to use an ambulance to go to the hospital or something.
Okay, could you track, when did you start, where are you now, and where are you going?
Okay, so, the grant itself was awarded back in October 2014, but then there's a process of interviewing, and all of the positions have to be ultimately approved by the Centers for Disease Control, which that in of itself is a process.
Yes.
It's a 30-day approval. And so that being said, Kellen and I came on board in January. And as I mentioned to you before, we have a scripted work plan that was written and submitted along with the proposal. And so this grant tells you it's broken down by quarters, and we know what we have to do by quarter, and so I think we hit the ground running, and I think we've really made progress in terms of identifying partners to work with and really develop relationships. Right now we're in the process of preparing for our next quarter deliverable to CDC, which is a cultural competency conference in which we hope to educate the healthcare provider, the physicians, and how to, in 15 minutes that they have with that patient, how are you delivering that service to a patient that does not speak the language or whose culture may be one that has no trust for the physician.
Right.
So if the patient happens to be of a Haitian community, the patient may speak French and the nurse may speak French, but does the doctor understand the culture?
Right.
Likewise with a Latino member of the community. I speak Spanish, but I don't identify with the Latino culture. So am I delivering that service? Is this patient understanding? If this patient has diabetes, does this patient know how to manage that diabetes when he leaves the office? So those are all things that our program helps to focus on and really bring in the healthcare community on board with the community through clinical linkages, is by educating the healthcare provider and understanding the language and the cultures of our communities.
And where have you both felt the most appreciation for what you're doing?
I can say personally, I felt really welcome in the faith communities around here. They've opened their doors and they've, showed me their leadership teams and said, what are you here for? What are you here to teach us or sell us or show us? And I can sit down and say, no, tell me what's affecting your group of people. And I think that's been really helpful. and building that relationship. And then we are going to follow up, and we're going to have screenings and trainings right inside their churches. And I think that's going to be really helpful, especially for people who work long hours, who work 2 or 3 jobs. It would be really great after Sunday Mass when they're already at church to just head out back and get a glucose screening if you want.
That seems very convenient.
Absolutely. Just recently,
yeah.
we had a meeting with a faith leader in the Haitian community, and he said exactly that. What can you give my community? And then after, absolutely.
Yep.
So after a very pleasant, long conversation, he said to us, "I have about 2,000 people altogether that you can reach."
Wow. So that's, that made you feel good, right? You say, okay, we've tapped into a resource,
and then he started
in a way
talking,
to deliver the results.
Exactly, and he started talking about personal stories where members of his congregations, parents and grandparents may have been sick. One has a high blood pressure, one has diabetes, but they're not really managing. So we began conversations. And conversations lead to outcomes, and outcomes lead to a positive, healthy lifestyle.
Well, this is a very good program. I'm going to touch base. First of all, I want to thank our volunteers. We've got Leo McGowan is behind the camera doing a fabulous job. Gina Coe is out with Roy Cohen producing the show. I wanted to touch base about, we're going to run some credits. So if they're ready, we'll be starting that. And in the meantime, I want you guys to think about, what sort of things do you want to make sure that you get across to the public after we review some of the credits that we have to do.
Sure.
So. How are we doing out back there? Good.
Hi, it's Gary LaPierre, and the crew wants to thank Maxie's Delicatessen. That's at 117 Sharon Street in Stoughton. They're 781-341-1662. American Cancer Society, yes, they're looking for volunteers. Drive cancer patients to and from their treatments. 1-800-ACS-6662. Or just go to www.cancer.org. Ilsa Mark's Food Pantry in St. Anthony's Free Market, 2 Park Avenue in Stoughton. For more information, call Christine Gallagher. That's at 781-341-0611 or 781-341-0549. Meals on Wheels. Just ask for Jessica. You'll find her at 781-344-8882, extension 2. Stoughton Penny Saver, our business is advertising your business, they tell us. 27 Rose Glen Street, Stoughton, 781-344-4833. Community Forum showtimes in Stoughton. It's Thursday, Friday, Saturday, and Sunday at 6 p.m., Monday at 8 p.m., Tuesday at 5 p.m. It's on Comcast Channel 9 and Verizon Channel 28. All comments and suggestions welcome. Contact us at communityforum1@yahoo.com. Community Forum showtimes in Easton. Mondays at 9 p.m., Tuesday at 8 a.m., Wednesdays 3 p.m., Saturday 10 a.m. And that too, Comcast Channel 9, Verizon Channel 22. Samaritans, they're at 41 West Street on the 4th floor in Boston, 02111. Their phone number is 617-536-2460. 24-hour helplines for Samaritans, and the number is 877-870-HOPE. That's 877-870-4673. Samaritans, you can find them at 800-252-TEEN. That's 252-8336. Or find them online at SamaritansHope.org.
Okay, and I'd also want to tell you about the Stoughton's very own Farmers Market, which is also part of an initiative from the Y, every Saturday, 10 a.m. to 2 p.m., and that's starting in June all the way to October 10th. It's at the Stoughton Center Church Green, a wonderful church there, by the way, and they are always making themselves useful, 790 Washington Street, to the community. They're hosting the Farmers Market, and they have been the most terrific people that you could imagine. So at the market, you can find fresh produce, breads and pastries, fresh fish, many, many more things with live music, weekly giveaways, a great staff. We're all volunteers down there. Those of you with SNAP benefits, we give you double SNAP, so that means that you will be able to double your purchases, and that will really help out with the grocery bill, I'm sure. We do ask you not to bring pets per the Board of Health. you can contact us www.stoughtonfarmersmarket.org. And the YMCA REACH program, that's what we're here to talk about today. We're with Alice Rebelo and Kendall Bennett, and their contact information is 781-341-2016, extension 268. And that's A Rebelo, that's one L, A Rebelo at oldcolonyymca.org. And they also have one of those awful Facebook pages. No, it's a good Facebook page. And that's www.facebook.com/oldcolonyymca.org. So please do access the information that's available for the REACH program. So I'm back with Alice and Kendall. So Alice, what have we missed so far? What do you think we should make sure that the audience who may want to participate, how can they participate?
Well, they can participate just by giving us a call to find out when the screenings will be up and running. We hope to have them up and running by end of July. They should be up and running. But they can go on our Facebook page. They can ask questions on our Facebook page. They can send an email. But one of the things that we're missing is really encouraging people to become involved. And there are many ways. So for instance, for a senior who's at the senior center having a cup of tea with her friend saying, there's some health screenings coming up, but why don't we all go? For the neighbor next door to a compromised gentleman who may be home without a caregiver, finding out, can I bring you to the doctor? For instance, the housekeeper going in to clean the house and looking at this compromised lady who happens to be diabetic and looking around and noticing that there's too much sugary stuff around that this person shouldn't be having. So initiating that conversation, let me bring you to a health screen. Let's talk about how you can manage that disease and let's talk about how you can eat healthier in an inexpensive way. So let's go to the farmer's market, for instance.
So it's sort of a neighbor-to-neighbor approach?
It is. It's a neighbor-to-neighbor. It's a friend-to-friend. It's a family member to a family member. It's anybody who happens to know somebody.
Now, Kendall, I'm thinking that you couldn't feel better about this job than you do.
I do love this job. I'm really happy to be working in my own community. I've lived in Stoughton my whole life, as has my mom and my grandparents, and so it's been really great to and unexpected to get my master's in public health and biostatistics, and then for a job to almost immediately open back up in my hometown for that exact field has been really great. And I just love that so much in this field has become data driven, and people are really interested in getting quantifiable results from this, and I really hope that that's something that we can provide for them by the end of this. We are working with a great evaluator from Bridgewater State University along with myself, and we have already started collecting huge numbers, and we will keep collecting all the way through the end of this and try to make sure that we have some concrete data on our community, because we have state data, we sometimes have county data, we have United States data, but we need to see what's going on in our actual communities. That's really going to help us, and I'm really excited to be a part of that.
So just for a second, if you could, if there was a mom of a high school sophomore, junior, who was thinking their child would do really well in a statistics kind of a course, or even just biology, what would you say to them?
I would say definitely look into the field of public health, because everyone keeps saying it's the big next field. It's growing. So many people are really getting their eyes on prevention, and it's a great way to work in the health field without having to go through medical school and be a doctor or something like that. As our population ages, we're just going to need so many more people working in these fields, and I think it's a great idea. And to definitely come down to the Y. We'll let you volunteer. We'll help you out and help you explore the field. I would love to give back to someone what so many people let me do back when I was younger, and volunteer and intern at all these different crazy places. And yeah, we would love to encourage more people to get into this really good work.
All right, before I'm going to ask Alice a little bit about Brockton, but before I do, I want to point out that yesterday on NPR, the statistic came out that millennials now are a larger group than the baby boomers.
Oh, no.
It has now taken hold. And the reason they suggested that was so important was that those are the people who are going to be buying homes. They're going to be having children. So this 18 to 35 group of millennials, 18 to 35 years old, they're now more, and we've heard for years, right? It's baby boomers getting old. They're the biggest part of the population. Right. Not so. So just so that'll help you statistically to be thinking about that. So now, tell me a little bit about what you can do for Brockton, because Brockton has a significantly larger population than Stoughton. And I'm thinking that there's also a considerable amount of economic challenge there. So how have you focused on Brockton, because it's a Stoughton-Brockton program?
Right. So with Brockton is going back to building those relationships with the providers, with both the non-traditional and the traditional service provider, building relationships, creating venues in which we can bring those health related tools to the community, speaking to the faith leaders, because those are the target population people we need to reach out to. It really developing those relationships are essential, and programs like this, really getting the word out, partnering with the healthcare providers. We have formalized a partnership with the two major hospitals, as well as
which are Signature,
which is Signature and Stewart, which is Brockton Hospital and Good Samaritan Hospital, okay, as well as with Brockton Community Health Center. So we do have some good relationships already formalized. And in addition to that, we're also developing an e-referral project. And the e-referral project is a mechanism that will link the community to the clinical. So everybody will be able to make a referral. So the physician sees this patient, refers back to the YMCA, Diabetes Management Prevention Program. The patient is followed through this program. Then a report is sent back to the physician and saying, this is the outcome of your patient. The patient has lost some weight. The patient has developed healthier eating habits. So anybody will be able to make a referral, but then it will be in a health record that doctor will always be able to access.
Would it be safe to say that some of your first clinics will be at the Y? And they deserve a great big kudo, right?
Absolutely, absolutely. If not for the Healthy Communities Coalition getting together, again, those same healthcare providers coming together with the YMCA and saying to the Centers for Disease Control, we've already determined the social determinants of health. We already have, programs to support people where they work, where they live, where they eat, where they sleep. Let's move a step forward and make our community healthy.
Well, I want to thank you both for coming to represent the racial and ethnic approaches to community health.
I'm proud.
The REACH program through the Y. And I want to thank our volunteers, and that's Leo McGowan, Roy Cohen, and Gina Coe. Thanks for watching Stoughton Media Access Corporation.
Thank you.